Hi, this is Dr. Baxter. We're going to talk about tongue tie stretching for children, teens, and adults. First, we're going to start with children. It's 2 to 3 times a day for 4 weeks, starting the day after the procedure. Lift up the lip all the way up. Make sure you can see the whole triangle or diamond shape open up, and then massage right on there about 3 times. Pretty firm pressure, like you're massaging. Pretty firm. If you just lift a little bit, it won't work. Flip it all the way up. Okay, just like that. For the tongue, you're going to hold the lower jaw with the non-dominant thumb. Use your index finger to push straight down in the floor of the mouth, then back all the way. If you don't lift it all the way up, it will stick back together. If you don't use enough pressure, it will stick back together. And that one was just done, so that's why it looked like that. But normally you'd have a white-yellow scab. Deeper stretch, 1 time at the 1 week mark, or if symptoms come back. Notice there's a T shape on there, like a horizontal line. That's where it's sticking back together. Push straight down, pretty good pressure, and it just opens right back up. There will be a little bit of bleeding, however, so keep that in mind. If you do need to use a tooth chair on maybe a 2-year-old or 3-year-old, just have them rest their teeth on there. And then you'll notice this one, it was sticking back together a little bit. There's a horizontal line again. So we're going to push straight down and it will just pop back open because it's healed on top but not below. So push straight down and then it's just open back up. So it's better to do that than having to laser it again. We don't want to laser it again if we don't have to. And so for teens and adults, again, 2 to 3 times a day, but for about 6 weeks if you can. If you did have sutures, you can wait 3 days to do these stretches. So push right on it. You're going to lift the lip up. Same thing like for kids. Push right on there about 3 times. Pretty firm pressure. Almost always when you see it grow back, it's because there was not enough pressure. Push on the left side of the tongue. We're going to push on the right side of the tongue, kind of massaging it back, making sure we get the most mobility possible because we don't want it to stick back together. This one was to the tip beforehand. Then we sutured it, and then all the way back right on the sutures. And don't have them stick their tongue out, but just push right back on it. Next is a helpful tip. You can use a paper towel or some gauze if you have it, and have them stick the tongue out, or you can stick your tongue out if you're an adult, and then pull it to the left and hold it for 10, 20, 30 seconds as long as you can. Just put some good tension on it so you can feel the stretch. Straight out, same thing, just pull it and just kind of hold it, and then to the right and just hold it and put some good tension on it and increase the mobility. And as always, if you do have any questions or concerns, please feel free to call us or email us, send us a photo. We want to make sure it works for as many people as possible. Thanks so much.